Pharma keeps talking about breaking silos, but as the host of the hugely popular Amplifiz podcast, Guillaume Villard warns, it's make or break time. The patient is now the CEO of their own health, and unless medical, commercial and marketing actually talk, well, nobody wins. Ahead of his new Amplifiz Pharma and MedTech conference in Singapore, we go full back to the future on what real collaboration looks like. This is Off-Label. Let's plug in. Guillaume, welcome. First off, from one podcaster to another, congratulations on Amplifiz. I must confess, I'm a bit starstruck, a little bit of imposter syndrome. Welcome, and can I first ask you, what's the secret behind a successful podcast like Amplifiz?
Oh, thank you so much. That's a great question. It's been nearly 2 years now that I started, and I'm still trying to figure it out myself. I think we have been very, very lucky to find an audience quite quickly. And it really boils down to the guests, their stories, their ability to share genuinely. This is really a very fun journey for us and a lot of learnings for me.
Indeed. Well, I've noticed that you've got the momentum of a runaway freight train at the moment, and with that comes greater interest from not just the community, but the speakers that are coming along. So, as you're the master, I feel like I need to give a good performance to interview a master podcaster. But there's a couple of things that are really important to discuss today that will take you away from your normal discussions, and that is we want to talk about something that I'm passionate about, as you are as well, and then we want to talk about how we can address that. And the first thing we want to talk about in terms of the issue is that the good old silos, cross-functional collaboration issue. They're not just buzzwords. We hear about them a lot. This is actually make or break stuff for delivering real value to healthcare professionals and patients and to help move the industry forward. So, Guillaume, you've said that the HCP and the patient journey is getting so complex that no single function, medical, commercial, access, affairs, whatever, can tackle it alone. So why do you think this need for collaboration has become urgent now?
Well, I mean, that's the billion-dollar question for the industry, really. There's a couple of layers of answers. The first one is that the patient themselves, the way they behave, the way they are now the CEO of their own health, they do their own research, and the dynamic that we used to have between a practitioner and his patients as drastically changed. So what does it mean for us in pharma or in MedTech, and how can we better equip the ecosystem and the physicians in entertaining these conversations with patients that are more and more, self-educated, doing research online and so on. They were going to Dr. Google a few years back. Now they go to ChatGPT and so on.
Yeah.
So, what does it mean for us? And that's the first thing. The second element is more internal to the industry now. Everybody's excited about AI, but AI needs data and needs structured data to provide value to any business, regardless of your sector. The reality is that pharma doesn't lack data. They just need to ensure that they are putting the pieces together. Because if you keep the silo between medical affairs, between marketing, commercial excellence, sales, and whatnot, you will never be able to understand truly the HCP or the patient. And so in this era of talking about patient design, customer centricity, and so on, we as an industry have still a lot of work to do.
So I was wondering, there's a lot of challenges, but what do you think is one of the biggest ones that keeps functions? But not only, you've introduced another element that I hadn't really even considered in the mix, and that is the silos now between the doctors and the patient. That never was an issue, and now it is. But you've got silos in between functions within companies and silos between companies. So companies aren't talking to each other either. And all of that needs to come together if the industry is really going to move forward, right? So I mean, it's another $1 million question. What's one of the bigger barriers that's keeping functions and companies siloed?
Well, most of the organizations we are talking to on this podcast or at our events are very large enterprises. Right, the multinational, complex, international matrix organization. So obviously, that on its own creates layers of complexity. The other element is the tendency that we have in the industry to use regulation as a pretext for lack of innovation and not daring. The way I look at it is that the narrative around regulation that really has to change drastically internally. And I think the leaders have a good, important responsibility to play here. I don't know if you see my background, but I'm a huge basketball fan. And no one in any sport, in any team sport or individual sport, would come to his coach or to anyone else and say, "Oh, I lost the game because there are rules. And I could not win." Well, there are rules in everything in life. There are rules in pharma. There are rules in everything. This is the framework within which you have to play. And so don't say that it's a constraint. Don't say it is, what prevents you from innovating. No. These are the rules of the game that everybody knows, everybody follows. So we need to change the narrative internally and dare to innovate and dare to change instead of hiding behind this excuse or regulation is preventing me from doing this
really,
and that. It's a very provocative statement, but
no, it is. I like it. It's actually a refreshing one because too often with people blaming the guardrails or the frameworks which they have to operate within, but you don't have champion basketballers blaming the size of the courts or the hoops for their shots not going in and things like that. So you make a really compelling point. People maybe just need to work with what they've got and find solutions.
Exactly right.
So say we've got one or two companies out there who do start to adopt that type of philosophy and mindset. For those companies who do get it right, what can the future look like?
Well, first I want to talk about the external impact it provides, because you and I, we are also B2B buyers and B2C buyers every day. And we know, and we not only we know, but we feel, and we know how it feels to have a great experience, a great customer experience, or how it feels to have a terrible one. You fill up a form, you give information about what you need, and then you have a sales guy calling you, and you can tell in 5 seconds he's completely oblivious of all the information you have provided this company, and he starts to through his pitch and so on. So this is horrible to you as a professional or as a B2B buyer. The same applies for practitioners or to some degree to patients as well in some instances. So the end goal is to ensure that at every single opportunity that a physician has to liaise with his MSL, with a rep, with marketing touch points online or face-to-face and so on, he see a consistent and coherent discussion happening. That's right. So it boils down to what impact and how they feel about you, about your brand. Is it really a matter of how much value you offer to them, or are you more focused on pitching and promoting and doing more and more of what works, less and less?
Thinking about your own agenda and not the customers.
Correct. Yep. So that's the external fact. And the internal aspect, which is critical as well, frankly, is a happy workplace. Because it is so tempting to play the blaming game of, marketing doesn't understand this, or medical should do that, and this and that. I mean,
we've heard it for years, haven't we?
Short. Yeah. I mean, at the end of the day, there is a scenario and a world that exists out there where we are all speaking the same language. It's hard. Yep. It requires a lot of effort, but it is possible. And this is ultimately what drives efficiency and happiness as well.
No, I couldn't agree with you more. And something to that, I think there really needs to be a lot of responsibility placed on leadership to develop that type of culture internally. Sure, it's tough in some companies in the industry right now. It's going through a bit of a reshuffle, rejigging, restructural type of thing, which puts everybody on tenterhooks sometimes. But when the dust settles, it's the leadership that needs to get everybody on the same page and encourage and foster that happiness that allows that sort of collaboration to take place. I agree.
Yeah.
So look, cross-functional collaboration, it's possible, right? But at the moment it's kind of systemic and it's kind of a mindset. So let's take a look at ways to remedy this scenario we find ourselves in. And that brings us perfectly to your new conference in Singapore, the Amplifiz Pharma and MedTech Conference. First of all, congratulations on the initiative. I applaud anybody that puts their neck out there on the line to help drive the industry forward in whatever capacity that is. So number one, well done, thank you. But don't you have enough on your plate? You've got a job. You publish the most highly successful podcast in pharma. What's inspired you now to launch a live event on top of all of this?
Look, I mean, the same thing that drives you doing what you do, and I think most of us out there, is you reach a point in your life and in your career where, for me, after 20 plus years in corporate, I realized pretty quickly what was really making my day meaningful. and is to provide value. It's not to have this win or this project has been able to achieve this and that. I mean, this fades away pretty quick. Conversely, when you are able to help someone achieve its goal, when you are able to help someone meet someone else that he wants to engage with, when you help someone get a new job, you feel pretty good about yourself. And so, frankly, this has always been driven by this genuine desire to help out. I've been working and being part of this industry myself for some years, and the mission that we all pursue is the most meaningful of all, right? We work towards better access, better diagnostic, better treatment, better care for patients all around the world. But the journey we are on as individuals is a challenging one for the reasons we talked about, complexity of the organization, metrics, and so on and so forth. So if I can provide a little bit of value in helping people in their professional journey, to learn from peers, to be inspired by them, to share and come back home or work with new ideas and a feeling that nothing is impossible as long as we go there together. I would be the most, the happiest man in the world, really. And there's nothing else than that.
It's inspiring, and it does resonate as well. You can have all the wins and kicking goals from a commercial point of view, but when you actually know an initiative or something you've worked on has provided value and made a meaningful difference at a maybe a personal level and an industry level, hopefully, nothing can replace that. And that's the mark that you make. So well done. Everybody should be inspired by hearing things like that. Now, let's focus a little bit on the event itself. I'm really keen to unpack a bit of it. I'm also really keen to come to it. I'm just trying to find a way. So I've had a look at the agenda, blew me away from the start. Looks like you're opening the meeting with a wake-up call for a practitioner who's going to spell out exactly what HCPs and patients expect from Pharma.
That's right.
Can you give us a little hint about what's going to be happening on that one?
Well, I don't want to say too much, right? But we have indeed a practitioner coming in, opening the session. I mean, we talk about customer centricity, right? So of course we need to start with their voice, hearing them firsthand. So we're going to have a practitioner coming in, deliver a keynote. His name is Dr. Zubin Daruwala. He is a practitioner surgeon in NUHS, which is one of the largest public hospital group in Singapore.
Okay, wow.
And beyond being a well-renowned surgeon, he has also been working for a consulting company, and he was leading this healthcare life science business. So he has really this very interesting and unique profile of being a practitioner. And at the same time, knowing the other side of the fence, understanding pharma and MedTech from within. So he's very much into the game of, I'm not going to show up just to tell people what they want to hear and take pictures and move on. He wants to provide value. And as we all know in our lives, some truths are important to hear, whether they are painful to hear or not. We need to hear them.
Yep.
And frankly, we cannot solve a problem that we ignore or that we, shy away from. So things have been, they need to be spoken out clearly, and this is what Dr. Daruwala will deliver.
It's going to get people sitting up and taking notice with a couple of truth bombs early on, and that's going to set the scene. Hopefully, is a very practical and valuable event. So moving on from that and reflecting back on the discussion we had just previously, how is this event going to address the collaboration challenge in the industry or in Singapore in particular?
Well, few levels of answers. The first one is that in the room, people attending this event, we have so far the registration is still on, but we have a good balance between medical affairs, marketing, commercial excellence, sales leaders, GMs, and so on. So that is already one thing. We want these people to be together, to meet, to speak, because more often than not, there's the medical affair meeting, there's the marketing stuff, and we don't always come together. So that's the first element. The second element is that the diversity is also going to be visible on stage. We're going to have medical affair directors, we're going to have marketing leaders, commercial, and so on. The third element that concerns the speakers and the content is the amount of work we are putting in right now with the speakers before the conference. We do workshops, we do brainstorming with the speakers. So they invest personal time out of work to come together, to prepare these things and so on. We really want to bring a lot of value to our peers in the room and have constructive conversation, not just the first guy on the panel who says one thing, and then 3 people who repeat it the same way. So that's what we are doing.
Okay.
It's important for the content, but it's also because, once again, since they are representing different functions, they need to come up with the same vocab, the same,
be
playing
aligned.
field. So and be aligned. So that's what we're doing.
Yeah, that's wonderful. So, am I right? Has there been a cross-functional industry event in Singapore recently? I can't recall one. I don't think Reuters have been. This is the first.
That's right. That's right.
Wonderful.
And that's why
that's
we
exciting.
That's a problem we're trying to address, really. Yeah.
Fantastic. So you said you've got a keynote, but and maybe a panel. Are they the 2 main types of conversation and formats that'll be helping people build this collaboration and not just talk about it, or is there any other elements?
We have keynotes and panels with a lot of Q&A interactivity with the
great.
room. And this is followed by a long evening of networking with food,
Excellent.
with drinks and all of that, so that people can really have a chance to reflect, to meet the speakers, to meet in between peers in the room. So it's going to be a fun afternoon and a fun evening together.
That's great. It sounds like a bit of a taking the mickey, but I do find at these events, it's the social activity afterwards that's just as valuable as the actual event itself. Because one, you get to meet people and network and communicate and catch up, but you also get to unpack what's been discussed during the day and connect with the speakers in particular to draw out any insights that they've raised during their sessions that you can talk more and learn more about. And I find that most speakers are only too happy to, first of all, they feel good that someone's been listening, but they're too happy to talk more about it. And there's a passion there that is really quite inspiring that happens over a glass of wine or soda water. So you've been connecting people through your podcast. Obviously, there's thousands of people that are coming together to listen to your episodes. What feels different about doing it face to face in Singapore? Do you have a different sort? Is there a different sort of energy or?
Yeah, for sure. Obviously, a podcast is recorded in a studio, so you have a very strong and powerful one-to-one interaction, and then you hope that this content is going to bring value to others. But yes, when they watch this online at home, there's not much interaction, right? I mean, there's Q&A, there's comments on the videos and stuff, but it cannot be compared. So all of us have been doing virtual calls for years now, especially after COVID. And myself have been in global roles for 7 years from here in Singapore. So a global role from Singapore means that you speak to Europe, to APAC, and to the US. So you spend your days with this kind of little headset on your ears. And a lot of people in Singapore have regional or global roles. So they are invited to go back to the office because corporate policies and so on, but they've spent their days in the office, not talking to anyone, on calls with Australia, with Vietnam, with Japan, and so on. So a lot of these folks are like me, feeling the urge of social interactions because look, I'm an introvert by nature. I became an extrovert by profession. But even as an introvert, I do see the importance of meeting real people and learning from them and talking as opposed to just, be in the office on virtual calls. So obviously that's going to be a big change between the podcast and the physical events. Having said that, there's a dimension, an element that we are bringing into the conference that is also going to be cool is that because we are a podcast as well, we're going to have some fireside chat podcasts recorded on site during the networking, during the cocktail and during the evening.
That's
so
cool.
It's kind of cool for people to see the behind the scene kind of thing. We will have a certain number of other guests from the industry coming onto that show. And so I think that kind of blends the two dimensions together.
Absolutely. I really like that. You've come up with a hybrid approach, leaning on the success of the podcast and the event. That is I would dare say that's a global industry first. We, My Medical Affairs, cover most of the big events that take place, and I've not really seen that approach. So I think, the people who attend this one are in for a bit of a treat. I actually had my questions here to ask what's, the usual, if whoever's listening based in Singapore or APAC, why is this a must attend? But I think you've answered all the questions. First of all, this is the first time this has happened in Singapore for a long time. It's an important hub. People have very important roles. They need to be, switched on and tuned in and dialed into the latest issues. You've got networking, talking about cross-collaboration, bringing everyone together, a networking evening, and also a podcast all bundled into one. Have I missed anything there? I feel like I've been sold and I'm selling back. Sort of thing.
No, you covered it all. But I mean, the point you asked earlier, why Singapore and why there was no event like this? I mean, this is also the question I asked myself. Singapore has more than 80 regional headquarters of large pharma, large MedTech companies. There's manufacturing plants, R&D centers. I mean, there's a lot of talents in Singapore in our industry, and yet we see these big, large event organizers focusing on the US, on Western Europe, on Japan, or recently in Australia. Some of them came over and so on. Never in Singapore. So when it's one thing to see the problem, it's another to try to solve it. And with a lot of humility, together with our speakers, we are trying to solve it and create that first pharma and medtech conference in Singapore. So that's fun
Wonderful.
to do.
Well, it sounds like it's not just another conference. It's really a push for the industry in the region to listen better to what HCPs and patients really need, and that is something that we can all get around. So again, Guillaume, congratulations on this initiative. Now, we always throw a little curveball in, and today's not going to be any exception. We like to ask, if this event were a movie, which genre type would it be and why? Action, rom-com, that sort of stuff. And bonus point if you can name an actual movie title.
Oh, man. Okay, so the movie would be, or the genre would be definitely something full of adventure and excitement, but with a positive and joyful end to it. And that's a good analogy of our careers in pharma and in medtech. It is a journey. We are going through ups and downs, and we learn a lot through that journey. But at the end, we do something very meaningful, and we can take pride in what we do.
I love it.
The other thing, in terms of what will be the actual movie, one thing that is important to me is to do what I do very seriously, but never take myself too seriously. And I tend to connect better with people who have the same DNA, because it's hard to connect with someone who gives you the impression that he or she is very important. So if you want to connect with peers, genuinely, you have to check your ego at the door and come in as a human being that we all are, regardless of if you're a GM or a junior medical affair colleague. And movie-wise, to reflect that pretty light and fun DNA of the event, but also to reflect that complex timeline, I would talk about Back to the Future, a movie from the 80s.
Marty McFly, the doc.
Of course. We have a lot of adventures, a lot of ups and downs. We learn a lot from ourselves, and we realize that the journey ahead is what we decide to make out of it today. So
wonderful.
That's what we're going to do.
That's a first of all just an absolute stellar pick for a movie, but it relates very well to the content and the conference that you're talking about. Guillaume, it's been as entertaining as it has been informative. I hope I've performed okay as a podcaster interviewing a master podcaster, but I've enjoyed it. I hope you have too, and likewise. I hope the listeners have also. So, again, best of luck. Congratulations on the initiative, and look forward to hearing all about it.
Thank you so much for having me. It's kind of fun for me to sit on the other side of the podcast for a change. So I'll speak to you soon, Steve. Thank you for having me.
Thank you. Bye for now.
See you.